Good morning. I'm going to talk to you about a very important topic, which is congenital anomalies of the optic disc. It is very important for us to know because it can serve as a differential diagnosis of disc edema, and many of these congenital anomalies of the optic disc can be associated with decreased vision as well. So, like I mentioned, pseudo disc edema is a very important entity which can be confused with true disc edema and papilledema, which are actually severe conditions that can result in visual and systemic morbidity. So, we need to first be able to differentiate pseudo disc edema, for which we need to know the correct congenital anomalies. The various types which can be confused with true disc edema are medillated nerve fibers, a hypermetropic disc, optic disc drusen, tilted disc, and morning glory syndrome. So, we will look at each of this. A tilted disc, by definition, when we say tilted disc, we are talking about oblique insertion of the optic nerve to the globe. So, that is what you are seeing in this picture. The optic nerve head, which is the normal position of, is supposed to be like this, is now in a tilted fashion. Normally the insertion, which it looks like this. So, this tilted appearance is the reason why these patients are symptomatic, and one of the commonest causes of decreased vision is myopic. These patients can have what you call myopic astigmatism. Myopic astigmatism is one of the common associations of tilted disc because by virtue of the position of the disc. And when do we actually call it an optic disc? We say when we call it a tilted disc is because this direction, the diameter, when you measure the vertical length and the horizontal, if this ratio is about 1.3 or greater, then you call it a tilted disc. This has to be contrasted with what we call a torsional disc. A torsional disc is one in which the tilt is much more, up to 15 degrees against the vertical meridian. So, this is called a torsional disc, but today the picture that we are seeing is that of a tilted disc. So, whenever we look at a congenital anomaly, disc anomaly, we need to first question ourselves as to whether it is unilateral or bilateral and whether it is associated with any significant visual loss. So, this tilted disc is usually bilateral, and these patients clinically relevance is, one is the myopic astigmatism, second is they can have supratemporal field defects. So, why does that happen? Because this tilted disc is associated with peripapillary thinning. There is a peripapillary thinning, chorioretinal thinning. There is a peripapillary chorioretinal thinning, and these patients can have inferonasal fibers. The tilt is in an infronasal direction. Wherever the fibers are attached, it looks like it is elevated. So, these patients will have supratemporal defects in correspondence with the infronasal thinning. In the areas where the fibers are inserted superiorly, it can look indistinct. So, that is why it serves as a differential diagnosis for disc edema. And OCT is done in patients with tilted disc because you have to rule out two important complications. One is a serous macular detachment, can be picked up with OCT. Another is choroidal neovascularization. So, both these can be complications of a tilted disc, and that is when the patient can become seriously symptomatic.